What's up, y'all? It's GC Kinsey, here to talk about my gender-affirming hysterectomy, Part 2. I had a hysterectomy, which was my first gender-affirming surgery in December of 2023. And now, at a year and a half post-op, I'm making a series of videos where I answer your questions about what that whole experience was like. This is the second video in the series. The first part was about how and why I decided to get a hysterectomy, so check that out if you haven't already. This part is about finding a surgeon and all the pre-op preparations. Part 3 will be about the surgery itself. That will come out next week. And part 4 will be about recovery and life on the other side. That'll be out the week after. Once all 4 parts are up, they'll be linked in the description, but for now, let's get into part 2, which is all about pre-op stuff. And before we do, I just want to give a warning that I'll be talking about reproductive organs, including genitalia, bodily fluids, medical exams, and briefly mentioning medical trauma. So if any of that is not for you, I totally get it, and I have a bunch of other videos you can check out instead. And I want to give a disclaimer that even though I'm going to be talking about medical stuff, I am not a doctor or any kind of medical professional. I'm just sharing my personal experience as a patient. With all that out of the way, I'm going to start by showing y'all a timeline of all the events that led up to this surgery. And something I appreciated a lot was how relatively quick this timeline was. I've heard plenty of horror stories about multi-year-long wait lists for gender-affirming care, so I was fully prepared to face that, but no. I got the ball rolling in February of 2023 and had surgery just 10 months later in December. And by February of 2024, a year after starting this whole process, I was already fully healed. So now I want to talk about these pre-op stages in more detail by answering your questions, and I'll start with this one from Les5503 on YouTube. How did you go about finding a surgeon? I might want this in the future, and I feel like in my area it would be a challenge to find one that will even perform elective hysterectomy, let alone for trans people. And yeah, that is a very valid concern. I pursued my hysterectomy through a transgender health program in my area. This program isn't a gender clinic, it's more like a network of trans-informed providers and a service that helps match patients up to them to get the gender-affirming care they need. So you might see one of those providers at a local hospital or at their private clinic. And I want to acknowledge something that this question highlights, which is in my area, because access to gender-affirming care varies a lot depending on where you're located. I am well aware of how fortunate I am to live somewhere that even has a transgender health program. A lot of trans people have to travel, sometimes very long distances, to find the right surgeon. In particular, with hysterectomies, it can be hard to find a surgeon who's willing to perform one on someone who's still young enough to have children, hasn't had any, and might change their mind one day, trans or not. Finding one who's willing to put your bodily autonomy first and who's trans competent can be hard. But it's not impossible. Those surgeons are out there. My best advice is to figure out your parameters first. What are you looking for in a surgeon? How far are you able or willing to travel? How do you plan to manage post-op care? What's your budget? Those kinds of things. And then search for surgeons who meet your requirements. And lean on trans community resources to help you with your search. If you have a trans clinic or health program in your area, that can be a great place to get started. But also ask for advice from other trans people about surgeons and read reviews from trans people about any surgeon you're considering. My local trans health program made finding a surgeon super easy. They gave me the name of a gynecological surgeon and scheduled me for a consult with her. I saw that she had positive reviews online, and I asked a trans friend who works in the same hospital she works out of, what do you think of this surgeon? What do her trans patients think of her? And my friend was like, I haven't met her, but everyone I work with says she's super nice. All her patients really like her, trans or cis. So I felt pretty good going into that consult, and I felt even better afterward because the appointment was fantastic. I clicked incredibly well with this surgeon. I could tell not only how experienced she was at working with the trans community, but also how passionate she was about helping us, which was awesome. She was nothing but supportive about me having this surgery. She didn't try to gatekeep me in any way because of my child-free status. She didn't judge me for any of my reasons for wanting a hysterectomy, and she was the first person to tell me that my long-held irrational fear of pregnancy wasn't so irrational after all and was not at all uncommon amongst her patients. She was super understanding when I told her about my past medical trauma and said that nothing like that ever should have happened to me, and reassured me that nothing like that would ever happen under her care. And she took plenty of time to answer every single question I had. So after talking to her, I felt completely confident that she was the right surgeon for me. Something else I liked about the consult was that it was a telehealth appointment, which was not only convenient, I could do it on my lunch break at work, but it also meant that in this post-COVID anti-vax mess of a world, I could actually meet my surgeon face-to-face on camera as opposed to mask in person. Plus, because it was virtual, I knew going in that it would just be a conversation and didn't have to worry about any potentially traumatic or dysphoric exams. Our conversation covered why I wanted a hysterectomy, my medical history including my transition, what to expect during surgery and recovery, and nailing down the plan for exactly which bits of my reproductive system I wanted removed, which brings me to this next question from Ilya's Odyssey 9626 on YouTube. I'm hoping to have hysterectomy and vaginectomy, and I'm worried about how hard it might be to convince doctors of performing them if I don't want further genital surgery. Could you speak on that maybe? Yeah, so during this consult, I mentioned that the parts I wanted removed were my uterus, of course, also my cervix, fallopian tubes, and one ovary. Just one in case I ever lost access to T, so my body could still have a dominant sex hormone without me having to take E. And I wanted my vagina closed up, or as some trans men and trans masks like to call it, closing the bat cave. The surgeon told me that she could do all of that except the vaginectomy because when you have that done for gender-affirming reasons as opposed to vaginal cancer reasons, it's typically not done through gynecology but through urology because it's often done as part of a genital surgery like metoidioplasty or phalloplasty where you're having your urethra rerouted. She said that learning to do a vaginectomy alongside a hysterectomy was a future goal of hers, but in the meantime, she could give me the name of a urologist who does lots of them on trans patients through the same trans health program. I suspect the real challenge for getting a hysterectomy plus vaginectomy is finding a surgeon who can do both more so than one who's willing to do both. If you can't find someone who can do both, then you could have it done as two separate surgeries. Or if you're lucky, you might be able to coordinate with two different surgeons to have it done in the same operation. Speaking of which, once my surgeon and I had figured out the game plan, the rest of the appointment was for Q&A. And the very last question I asked at the end, kind of half-jokingly, was, it's too bad this surgery can't be combined with the other surgery I need, right? Because I had been having a separate abdominal issue unrelated to my reproductive system that was also going to require surgery. To make a long and painful story very short, I had some scar tissue inside my abdomen from a past organ rupture that was putting pressure on my digestive system in a way that was making me throw up all the time, so yeah, not good, that needed to come out. And I couldn't help but think, while they're in there for one surgery, wouldn't it be cool if they could do the other, even though it seemed pretty unrealistic. So imagine my shock when this surgeon was like, no, that's actually a great idea, you would just have one surgery and one recovery, and started talking about coordinating with the other surgeon who was supposed to take out that scar tissue. She even said, I have a colleague who would be great for that surgery if you don't already have someone lined up, and then named the exact same surgeon my regular doctor had recommended, which was hilarious. So we set up a consult with him next, which I had in July, 2 months after my gynecological consult, and from there, the hospital where both these surgeons worked started looking for dates when they would be available along with an anesthesiologist. While the hospital was working on scheduling, I started working on insurance requirements. I didn't get any questions from y'all about insurance or finances, but I want to talk about it anyway because it's such an important part of planning for any surgery, especially a gender-affirming surgery. These surgeries tend to be expensive, and insurance companies tend to push back against covering them. I got very lucky because the trans health program I was working under had a nurse coordinator who knew exactly how to deal with insurance companies. She sent me the list of requirements for my plan, which involved getting 3 letters of support. 2 of them from 2 different mental health providers stating that I qualified for surgery due to gender dysphoria and that I was mentally competent to be sterilized, and 1 from my hormone provider, also attesting that I had gender dysphoria and verifying that I was physically healthy enough for surgery. For patients who weren't on hormones, that one could come from your regular doctor instead. The nurse coordinator also sent me a list of therapists in my network who regularly write these kinds of letters. But unfortunately, when I contacted them, they all said they no longer took my insurance, so the nurse coordinator then recommended that I look for therapists on the Gallup. And if y'all are unfamiliar with the Gallup, which stands for Gender Affirming Letter Access Project, it is an amazing resource. I've linked to it in the description. It's a database of therapists, mostly in the US, who have offered to write insurance letters of support for trans and non-binary patients for free. You can search it to find therapists in your state, see their qualifications, and contact them about setting up appointments. So I did that, and I had 2 great sessions with 2 great therapists, also virtually on my lunch break, who wrote my mental health letters of support. One of those therapists was also non-binary, which was extra cool. I got the 3rd letter from Planned Parenthood, which is where I get my testosterone. And after I passed these letters along to the nurse coordinator at the trans health program, that was all I had to do. She took care of everything else. And she somehow wrangled my insurance company into covering my entire surgery 100% so that I would pay $0, which still blows my mind to this day because out of pocket, it was quoted at $20,000. So yeah, number 1 piece of advice for getting your gender-affirming surgery covered: look for a program or clinic or surgeon's office who knows how to bend insurance companies to their will. Okay, this next question is from AO24764 on YouTube, who wants a hysterectomy someday. I'm also concerned with any pre-op exams. Would you mind sharing your experience on whether or not you had to have one? Given my traumatic history of painful pap smears and non-consensual in the case of my first one, I was also extremely concerned about pre-op exams. My gynecological surgeon ordered just one, a pre-op ultrasound to look at the size and shape of my uterus. And this is one of those things where your mileage may vary depending on your surgeon and your medical, especially reproductive history. Different providers may ask for different things. When I got my insurance letter from Planned Parenthood, they actually suggested that I get one more pap smear before surgery, but my surgeon didn't think I needed one because I'd never had an abnormal one, I wasn't sexually active, I had no family history of cervical cancer, and we were just gonna take out my cervix anyway, so that was obviously a huge relief. But one thing that did send me into panic mode was the confirmation email I got from radiology that labeled my ultrasound as a transvaginal ultrasound. That seemed astronomically worse than any pap smear could ever be. So I sent my surgeon the most cursed email of all time where I was like, if I can't be knocked out for this, then can they put the wand up the back door instead? Like, anything to avoid adding to the trauma and dysphoria I already had. And she got back to me the very next day, apologizing profusely for worrying me and saying that she had not ordered a transvaginal ultrasound, she'd ordered an external one, and saying that she had sent radiology a reminder about that before my appointment. This is why my surgeon was freaking awesome, y'all. And to that point, I want to share this comment from Bishop Deacon Cardinal on Instagram. Not a question, but something to mention. If you have trauma, they can do a lot of pre-op stuff under anesthesia, like a PAP, biopsy, pelvic exam, internal ultrasound. Tell them you have trauma and that you'd like to be put under. A thing to also mention, if your doctor words it right, your insurance will usually cover it. And yes, 100% agreed. If you have concerns about any pre-op exam your surgeon orders, tell them, whether it's because of trauma or dysphoria or any other reason. You don't have to put yourself through something that's going to make you miserable just to get this surgery you need. So ask what your options are, whether it's having an exam under anesthesia, having an exam performed in a different way, or even seeing whether an exam is really necessary. Definitely ask them to work with insurance to get any exams under anesthesia covered as well. And if your surgeon dismisses your concerns about pre-op exams or doesn't take you seriously, then I would consider that a red flag about whether that surgeon is really right for you. Anyway, I had the ultrasound, and aside from almost peeing my pants because external pelvic ultrasounds require a full bladder and their schedule got behind by almost 90 minutes, it all went fine. It was literally just jelly on the belly, so nothing painful and nothing that made me feel dysphoric. The ultrasound tech actually had a transmasc nephew, so that helped her understand my whole situation better, and she was super respectful. Not long after the ultrasound, I had one more virtual appointment with my gynecological surgeon for final Q&A, which was something I'd requested because it was now almost time for surgery in December and I'd had a lot more questions come up since our initial consult back in May. Aside from the ultrasound and the Q&A, all the rest of my pre-op appointments were for the other surgeon who is taking out the scar tissue. He ordered a CT scan, MRI, and blood work, all fasting, so compared to that, the ultrasound was the easy part. The blood work was done at the same hospital where my surgery was going to be performed 1 week prior, and that was part of a larger pre-op appointment where a nurse walked me through everything I could expect on surgery day and gave me my final instructions. To mitigate bleeding risk during surgery, I had to stop taking all vitamins and herbal supplements beforehand, including drinking tea, and this doesn't apply to me, but they also said to stop taking blood thinners and drinking and smoking. I've heard some trans people say that they're advised to stop taking hormones prior to surgery, but I was never told to stop taking testosterone or to stop taking the pill to suppress my periods, so I didn't. And apologies because this is kinda gross, but they also had me do a bowel prep. So basically, clear everything out the same way that you would before a colonoscopy. In my case, that was because they were going to be excising scar tissue that was all up on parts of my digestive system, but I do know at least one other person who had to do the same thing for a regular hysterectomy as well. And I guess the logic is that if you're operating inside the abdomen and you accidentally nick an intestine that has stuff in it, yeah, that's not going to go so well. So nice and empty is a lot safer. The scar tissue in there had been making me throw up so many times in the last couple of months leading up to surgery that under the guidance of my doctor, I eventually gave up on trying to keep any solid food down for 16 days leading up to that surgery, which made the bowel prep the day before easier, but it also meant I was tired and low-key hangry 24/7. And unfortunately, I was too excited and nervous to get very much sleep. But at that point, it didn't really matter because I was so close to the finish line and I knew that things were going to get so much better on the other side. So that covers all the pre-op stuff, and now is where I want to wrap things up for part 2 of this retrospective and turn the conversation over to you. Big thanks again to those of y'all who sent me questions about this surgery. I'll be answering more in part 3, so look out for that video next week. And for now, if you have any additional questions or thoughts, advice, experiences you want to share, drop a comment below and let's get a discussion going. You can also reach out to me on other social media. I'm GC Kinsey across all platforms. And while you're here, feel free to check out some of my other videos. I've got more vlogs like this one about my experiences as a queer person. I've got cosplay music videos, cosplay tutorials, a whole bunch of cool resources for singers about voice changes on testosterone, and more right here on this channel. So make sure to like and subscribe so you don't miss anything new. And with that, thank you so much for watching. I really appreciate all of your support. Happy Pride Month, and I will see you on the next one.